it shows the value that you really give to this conversation we want to have today. I'm from the US. So this means that this is really valuable. As Gloria had already said.
We'll just talk us through some of the findings. So let's...
You live in high-income country, low-income country.
And with the zeal to see how we can contribute towards the fight against that.
Cancer does not discriminate. We'll try as much as possible to keep to time and ensure that this conversation moves smoothly.
I am here on 2 grounds. As much as possible and compromise.
Okay.
Good afternoon, everyone.
Thank you very much, sir.
On perception, attitudes,
of JNC.
and just a bit about NOI polls, where next slide, please. We're Nigerian-based opinion polling and research organization founded in
and trying to provide solutions to this kind of serious challenges that we've been having in our health sector. And from this kind of thinking, we'll be able to at least have a lot of inputs when policies are being made or when we are trying to legislate. If you look at it today, how to fight cancer is not just government, it's all of us. And then we must also be able to go with some of the policies of government. And then 45,000 is coming from generators. We have almost 22 million generators in this country emitting. And from there, our health hazard is creating a lot of health hazards for this country. So with this kind of forum, we'll be able to come out with ways and means that we'll be able to tackle this situation. And what I've seen today, there is hope for Nigeria.
Fourth is we say we'd like to have bulk purchases of life-saving drugs and vaccines. With economies of scale, we as Nigerians will be able to get access to quality equipment as well as pharmaceuticals at reduced prices because of the economies of scale. Also the reintroduction of independent drug revolving funds. We also need to start doing more clinical trials of chemotherapy drugs and other essential medicines in our own country. And now with the setup of NICRAT, our own agency for research and treatment, we should be able to do that. Some of the benefits of the Cancer Health Fund, most importantly, providing access to high quality cancer care to the poor and most vulnerable patients across our country. We will also be able to build better expertise, keep our resources in country, especially our human resource. And most importantly, we reverse medical tourism. Our $5,000, $10,000 that are going to Kenya, Ghana, India, will keep it in country, and Nigeria will become a center for medical tourism, not only for cancer, for several other things. More collaborative approach with government, being at the table with government when policies are being formulated.
Working on prevention includes education, educating the citizens, and as you know, just in October, we know there will be human papilloma vaccination, virus vaccine in young adolescents. We gave 7.7 million young adolescents this vaccine. This is the biggest in the entire Africa. This is 7.7 million people were vaccinated, adolescents were vaccinated. As we know, this is to prevent them from developing cervical cancer, which is one of the second biggest cause of cancer deaths in our population. We're doing that in the area of prevention. We're also upgrading our infrastructures and equipment in the hospitals. We're investing in diagnosing in equipping the hospital with more diagnostic equipment, X-ray, CAT-scan, MRI. This will enhance our ability to diagnose cancer early and then start treatment early as well. We also have the National Cancer Fund that is being managed in the Ministry, in the Federal Ministry of Health, to support people with cancer. This better management of this fund now. This fund has been moved to the National Institute of Cancer Research and Treatment to better manage this fund, to use technology in managing this fund more. We're working to encourage more companies to come in, and we're also domesticating, enhancing our local pharmaceutical company to fill those gaps.
So I think there are two situations here. We have a short-term quick fix, and we also have a long-term. The short-term, actions that need to be taken is issues around taxation. Some of the pharmaceutical companies are really getting a high taxation. It's also the second issue about forex exchange. Forex exchange have not been so stable in a few months, so these are issues that the federal government really need to fix urgently. I think in terms of long term, we need to really build our capacity for clinical trial. About 80% of cancer drugs that are actually given to so many patients in Nigeria were not field tested in Nigeria. We don't even have patent to these medications. So if we do, by that time, it will be easier to start thinking about, having local production of this medication, so that even when foreign pharmaceutical companies leave, we have our own local ones that can really produce these medications. So on the long term, this is really also a wake-up call as well to private sectors to begin to think about how they can invest in cancer and also cancer healthcare. I think it's also very important to mention that the integration of cancer into health and other sector is so crucial.